Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on what is currently being tested on the ANCC as well as AANP exam. Now, any of my videos where I am talking on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states, a patient presents to the office with complaints of hearing loss to her right ear. The nurse practitioner conducts the Weber and Rhine test. Rhine results are AC is greater than BC. Weber results there is lateralization to the left ear. Based on these findings, how should the nurse practitioner diagnose? Is it A, conductive hearing loss, B, sensory neural hearing loss, C, cerumen buildup, or D, no diagnosis can be determined at this time? I don't know why it always tries to convert cerumen to ceremony, but y'all, it wasn't me. Autocorrect. But C says cerumen buildup. All right, I always recommend reading the stem of the question first to ensure that you are slowing down and answering truly what is asking you, right? So here, the stem of the question states, based on these findings, how should the nurse practitioner diagnose? All right. So when they're talking about diagnosis, I always tell y'all to run it back and look at the assessment findings. So this patient came in complaining of hearing loss to her right ear. Weber and Rhine done. We do the Weber and Rhine test to assess for hearing loss to determine the potential cause and source, so we know how to proceed with management and treatment, right? So the Rhine results was AC is greater than BC, which is the normal finding, what we want to find, right? And the Weber results was that it lateralized to the left ear. And this is abnormal because we know with Weber, they should hear the sound equally in both ears. It should not lateralize to either ear, right? If it does, that's abnormal. Then if it does lateralize, you want to pay attention to which ear it lateralizes to, because that gives you even further inclination of the diagnosis, right? So this patient is complaining about her right ear, but the sound has lateralized to the left ear. So when there is lateralization to the unaffected ear, to the opposite ear that they're complaining about, that is considered sensory neural. So the best answer here is B, sensory neural hearing loss. Question number two, a patient presents to the office with complaints of hearing loss to the left ear. Weber and Rhine exam has been completed. The Rhine results are AC is less than BC. And the Weber results are that the sound lateralized to the left ear. Based on these findings, how should the nurse practitioner diagnose? Is it A, conductive hearing loss, B, sensory neural hearing loss, C, presbycusis, or D, no diagnosis can be determined at this time? All right, so stem of the question here, based on these findings, how should the nurse practitioner diagnose? So again, you want to run it back and look at those assessment findings. So the patient comes in, they're complaining about hearing loss to the left ear. Again, Weber and Rhine is conducted because this is what we do. If somebody's complaining of hearing loss, of course, you want to look in the ear, but you also want to assess hearing loss on this standard entry level with those common utilization of the tuning fork to assess with Rhine and Weber, right? So here, the Rhine results, BC is greater than AC. So we know that's abnormal. AC is supposed to be greater than BC, meaning air conduction is supposed to be greater than bone conduction by a 2-to-1 ratio. When bone conduction is greater than air conduction, that is an abnormal finding. So we'll hold that here, right, knowing that this is abnormal. The Rhine test is. And then with Weber, it has lateralized to the left ear. Okay. So any lateralization with Weber exam is abnormal, right? Remember that it should not lateralize to either ear. When you complete this assessment, and you ask them which ear do they hear the sound better in, or do you hear it equally, they should hear it equal in both ears. So what do we have? BC is greater than AC, and the sound lateralized to the ear that the patient is complaining of, so the affected ear. That is a conductive hearing loss, okay? So conductive hearing loss. With conductive hearing loss, bone conduction will be greater than air conduction, but also with conductive hearing loss, the sound will lateralize to the ear that the patient is complaining of, the ear that is affected, right? And I'll add my video that where I teach on it and give you mnemonics and things to recall that. But just know, like, if something like cerumen buildup or a pebble in the ear or something in there is blocking that sound conduction, right? And so when it is something in there, that sound is going to lateralize to what is basically, for lack of better terms, the sound is bouncing off of that, right? Is how I kind of picture it to kind of help you retain that. So again, if it lateralizes to the affected ear, meaning the ear that the patient is complaining of, you want to think conductive hearing loss and see if it's something in his ear that needs to be removed. Okay. All right, and lastly, question number 3. What is the most common type of sensory neural hearing loss? Is it A, cerumen buildup, B, otitis media, C, presbycusis, or D, presbyopia? Take a moment and tell me what you got. All right, so again, the stem is the question. The question is the stem here. So what is the most common type of sensory neural hearing loss? And C is the best answer. Presbycusis is the most common type of sensory neural hearing loss, okay? The age-related hearing loss. As people age, they'll start to have sensory neural deficits. So presbycusis is that age-related hearing loss and is the most common. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure y'all meet me back here. If you need any of the resources that I offer, feel free to reach out to us at the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1 at gmail.com. Now, the things that I do offer are my review book. You can get it in an ebook option or the paperback option. They're both linked in the bio of this channel. It's designed for family and adult gero, broken down by systems. There's interactive sections per system, medication lists per system, questions and rationales at the end of the book, as well as pictures and images and charts to help you tie things together. Next, if you are someone who prefers to review independently, I have a self-paced review course designed for family and adult gero for both exams. It's broken down by system with a non-clinical section included as well. That is also linked in the bio of this channel. If you prefer a group review course with structure, broken down into small increments, I have a 5-week group intensive. The next one starts on September the 9th. This is the last one for this year. It's from September 9th to October 18th. If you're looking to join, go ahead and grab your space. I have 2 spaces available for that. Don't miss out. This will be your last opportunity for the year to join us on that. It's broken down over a 5-week span. And then that final week is an individualized week where I work and do a one-on-one session with you guys to let you know where you currently are, to assess your progression based off of the assignments and things that you completed throughout the 5-week duration, and give you your advice and tips and next steps that you should do to proceed after our class to prepare to go be successful on boards. Also, my QBank, I've launched the QBank, and it is broken down in different tier options based on what you particularly need. So there's a bundle, I should say there is a question bank designed for mini quizzes so that you can study. And then just like I do these videos, I go over the questions and rationale through a video form. So as you're doing the 10 mini quizzes, you can work through it and then listen to the rationales to see why you were correct or why you were incorrect, right? There's also 2 practice exams, so you can purchase one or the other, or you can get the bundle of all 3 of those banks that I just mentioned. But all of these are linked in the bio of this channel. And then lastly, again, I have heard you guys, and I relaunched my membership, but I designed it a little bit differently. This membership is designed for new nurse practitioners. So you pass boards, you're wondering what next to do, or you are a new MP in the field, and you just want that mentorship and connection to be able to ask those questions that sometimes we feel a little intimidated to ask in practice. So what this membership consists of monthly. We'll have things to help you with credentialing, to help you with interview things, to help you with negotiation. If you need review of certain contracts to see if your offer letter is a good offer or should you renegotiate. If you're working in a certain specialty and wanting to know different things or common diagnoses and how to maneuver with that, or soap notes and things of that nature, just a various amount of tools to make that entry level as a new MP a bit smoother. Okay. So just providing you with that network, that support, to help you in this new phase of your journey. Okay. So if you need any of that, it's $29.99 a month for the membership. That's linked in the description of this video, along with the 5-week review course is also linked in the description of this video. But y'all know what to do. Y'all make sure y'all meet me back here for some more practice questions, more study tips and videos. And if you have any questions or need me to cover certain things, feel free to shoot me an email. I'll add it in the rotation. But again, happy studying. Bye, y'all.